So today's topic is toxic response of the cornea, retina, and central visual systems. I would like to highlight one thing during this presentation. Apart from the title or headings, I have highlighted something with the red font. So please take care or even note that highlighted points, red color font might be useful or may be useful during your board examination also. So let's start. Here is the outline for the today's discussion. We'll start with the anatomy and physiology of the eye, because it is necessary whenever you are going to explore any of the system of the body and to understand the our compound, whether it's going to be create the desirable effect or undesirable effect. We have to understand the morphology and functions of that particular system. So here we are going to discuss about the eye, that is called ocular systems totally. So we'll see the anatomy and physiology of that, and then we'll see the exposure by whatever compounds like directly or indirectly, accidentally or occupationally or environmentally get exposed to this system. Then it would enter into the body and site of the action. So what body does to that, and what compound does to that, and what how it get delivered to that body part, and ultimately what metabolism or transportation role is there to take that compound or that toxicant to that part, and light, light will be taken. Light is creating the like any difficulties for the exposing to the ocular systems. We'll discuss over that here. Then whatever light exposure occurred to the system, and how would you come to know whether it's whatever exposure occurred, it's desirable or undesirable in pertaining to our context. It would be a like toxic response. We are going to evaluate the toxic response. So what are the parameter or what are the tools we have? We can evaluate whether it's toxic or non-toxic. So two criteria here we'll discuss in later, like further slides, like corneal irritation and ophthalmological tools we have. Then target, what target will get affected by this exposure, what kind of mechanism will be there, and then ultimately what guidelines impose us to regulate, perform this evaluation criteria. So here the eye includes the cornea, conjunctiva, sclera, eyelids, ciliary body, lens, retina, CVS, all the parts. CVS means why we have mentioned in the CVS, it's a central visual systems, is connected to central nervous system. That's what we are saying, the central visual system. Otherwise, the all ocular systems depends on the their own morphology and over function, but the later part or behind part of this ocular globe is retina, which is connected directly to the central nervous system, and it will give the actual vision or whatever object you have seen, what pictures you have seen, that will be reflected by the connection between the ocular system and central nervous systems. So environmental and occupational exposure to chemical and toxicant gaseous vapors, or as well as the off target, whatever drugs you are going to give with the other intended purpose, and it may create some toxic response to these systems. So that we have to understand first. So for that we have to understand the anatomy of the eye. So here we have kept the human eye, which is beautiful blue eye, you can see. So we'll see the layer by layer. First is the foremost part of this is the cornea, you can see over here. I'll show you that. Here is the cornea. Before cornea, one more layer is that is called the tear film, but it's not visible over here. But the cornea is very much visible and it's work as a lens of any camera. So it's a cornea. Then after you can see that it's a transparent layer cornea. Then after surrounding to this globe, or we can say that white part, that is sclera. And here between the cornea and this iris, here is the iris. There are the iris. And here cornea, and behind the cornea and iris between, there is one space being created here, that is called pupil. This is hollow part. It's nothing. It's not like any tissue or organ. It's been the space created by the iris muscles or ciliary body. While if you are getting exposure of the high range of light, so automatically your this ciliary muscle will contract and relax it, and then it would create constrict that hollow space, and it will call as a meiosis. While if you enter into the dark space, your this muscles will be relaxed and the space will be increased, so that hollow space will be increased. That is called a mitosis. So this mechanism is to protect your eye or behind organs, that is retina and lens, from the direct exposure of the high range of the lights. That's what this is the function of this iris and all, cornea. Then after you can see between this after that iris and all, one space is a round oval shape organ is there, that is called lens. It is transmitting the whatever lights or even imaging created through lights will passes, so it will passes to the lens and reaches to the retina, that is the behind part of the eye globe. So here from the cornea to up to iris, it's called the anterior chamber of the eye, while the iris to lens, it's called the posterior chamber of the eye, while the whole eye been divided into the two segments, that is anterior segment and posterior segments. So anterior segments carry the anterior chamber as well as the posterior chamber, while in the posterior segment will carry the vitreous humor, which is the whole part of the eye globe. It's carry the almost 80% part of the eye globe, and which carry the fluid, jelly-like fluid. It's work as a shock absorbance and protecting and nourishing the behind part of the eye globe. And then here is the retina, which carries the multiple rods and cones, which actually catching the pictures, whatever or object or pictures you are seeing, and with traveling through the optic nerve to the brain, and it will give the sense what you have seen and identify the that objects. So whatever you have seen, it will travel to the retina to the that central nervous system, and it will reflect into the picture whatever you see. So while any environmental or occupational hazards come into contact into this system, it may create a toxic response to the eye. So that is the one part. And second part is that if you are going to create any ocular drugs that has to be instilled into the eye, it may create the desirable effect, or sometimes it may create the undesirable effect. So some of the regulators insist us to thoroughly examination, or you have to perform the ocular toxicology studies before going into the market. That's what we have to understand the toxic responses of the eye, including this retina, cornea. Why like cornea, retina, there are the many part of the eye being mentioned over here, but here we are mostly describing about the major part is the cornea and retina, because these two are the like retina is the behind like our I would say posterior part, and while in the cornea is the anterior part of the eye. These two are the gatekeeper, which allow the any external toxicant to travel from the anterior part to posterior part. And retina, which also get affected by the any compound or toxicants comes to the systemic route. If you are administered any drug for the any purpose or any antidote route with the any antidote parietal or any other route, and it may be travel to reach to this retina and may create the some toxic response. So these are the both good gatekeeper. That's what we have to understand first, their morphology and their functions. So ultimately we can evaluate the whatever changes taken place over into the these systems. So whatever compounds or toxicant get exposure, like it may be chemical or systemic drug, can affect the all part of the eye wherever it may get reached to there, and maybe create the like desirable or undesirable effect. But eye itself has a protective mechanism or protective anatomy, and it has also some barriers which protect eye from to get affect from the toxic responses. So whatever compound get exposed to this, to understand that we have to understand what is the like factors, other factors is required to understand whether it's going to be affect at the site of the action. So whatever toxicants comes into the contact, their physiochemical property we have to understand. Then concentration, what concentration may be get, it may be a less concentration, not getting much effect. And duration of exposure, it is a short duration of exposure, it may not create the toxic response. Movement across the ocular compound, as I said, it may be travel from the cornea to retina. That depends on the property also, physiochemical property, and some of the barriers which allow to reach to there or not. That depends also. So a barrier also, like there are two barriers, physiochemicals and morphological barriers. Physiological barriers means routine process which is normally occurring to our ocular system. That is called blinking and tearing. You might experience like your eye, human eye especially, getting continuously blink after mostly about 5 seconds it will get blink, while in other animals or even other animals, especially like rabbit, it would take time 30 minutes to get blink. So that we'll see in later on. But here, this is the physiological barrier where any compound get exposed to the eye, so it may be expelled through the physiological barrier. Then morphological barriers. Morphological barriers, there is the like starting from the cornea, then iris, and then vitreous humor. There are many barriers. We'll see over later in other slides. So whatever compounds we apply to the topical route, it may travel to the tears, then maybe reach to the cornea. Depends. It may get expelled, so it may not reach to that cornea. Then enter into the aqueous humor, and by aqueous humor, it may come into the contact with the iris, ciliary body, and maybe reach to the lens. Sometimes the tear will allow, because there is some circulatory or vascular part is there, so it may be coming into contact with the nasolacrimal duct and maybe reach to the digestive system. Sometimes due to this conjunctiva is there, and it may be travel to the conjunctiva in a system to the blood and reach to the optic nerve or posterior part of the eye. Here, from aqueous humors to it may travel to the vitreous humor and to the retina. So, if any topical compounds come into the contact with the eye, it may travel like this only. So, to understand the once the compound or toxicant come into the contact with the ocular routes, so what kind of ocular pharmacokinetics means what body does to that compound or toxicant, and what kind of pharmacodynamic, what drugs will create the effect, whether it's a desirable or toxic response to the body. So we have to see the some barriers, as I said, for the morphological barrier. Then ultimately it reaches to the site of action and creating some effects. So first barrier for this apart from the physiological barrier, first morphological barrier is the tear film. Before the cornea, there is a thin layer which might be not seen. Sometimes it's a filled up with the only fluid you can see on over your eye. So it has three to four layer. First layer is a hydrophobic layer, which means secreted by the meibomian glands, and whatever toxicant or compound comes into the contact with it will be easily get expelled. And then second layer is which is little bit thicker than, and it will aqueous in nature, being produced by the lacrimal glands. Third layer is hydrophobic and hydrophilic in nature. So whatever compound or toxicants come into this contact, it may be reached to this third layer and may further travel to the cornea. There is fourth layer is there, but it not might be appreciable over here in picture also. But it is there sometimes and sometimes not been developed properly. So that's what I didn't mention. The fourth layer of the glycol is consistent. So this is also fourth layer for it. This is the structure or morphology of the tear film. Then further we forward to cornea. Cornea is the avascular part itself. It doesn't have any vascularity, but it has the 4 to 5 layers. Which first layer is the epithelium, squamous stratified epithelium. It is more like, I would say, harder layer, which is control the wear and tear of the cornea. Then second layer is a thin layer is there. You can see here, Bowman's layer. Then third one is the stroma, which is the comparatively larger, which larger in the size, and it is where the hydrophilic chemical is easily dissolved in this thick layer, and which can be act as a reservoir. Some of the chemicals which travel from the tear film to cornea, it may get resolved into cornea in this part of the cornea and may get remain to a longer period also and create sometimes a toxic response to that. Then after the Descemet membrane is that it is limiting membrane basement, which is called the Descemet membrane. It is the thin layer here. Then last layer is the, we can say, endothelial layer. The endothelial layer, it says high resistance to paracellular pathway. So this is the second layer, I would say, for the part of the morphological barriers which affect the pharmacokinetic or pharmacodynamic of the ocular systems. Then iris it's a pigmented muscular layer here behind the cornea. You can see earlier we have seen in that it is a remain behind the cornea, iris and ciliary bodies. They have the color pigment called melanin. It's carry the melanin pigment, which are melanin has like typical characteristics. It's a protein nature only, but it has typical characteristics. It may be have affinity to attachment to the polycyclic and aromatic hydrocarbons, electrophiles, calcium, or toxic heavy metals might be get attached to this part of the ocular system or eye. and it may create the toxic response over to there. Although sometimes it react as a protective, but longer duration it may be react for the by accumulating the chemical or toxicant, it may be react for the as a toxic response. So first, initially, if it is, we can say it's a have the protective mechanism, but if it remain constant or long time, it may create the difficulty. Then there is the ciliary body, or have the ciliary epithelium, which produce the aqueous humor, which nourish the anterior segment, or even I would say anterior chamber of the eye. Which have sometimes the compounds which have the hydrophilic in nature and less than 200 to 300 Dalton per. It may be easily permeable to up to ciliary body or epithelium. It may be reached further for the other part of the body up to retina also. The lens is the avascular tissue in the between the eye and aqueous humor. The aqueous humor and vitreous humor. It is remain like a junction from the vitreous humor to aqueous humor, and it binding the lens might be affect the ocular pharmacology, because sometimes what happens, whatever toxicant travel from the tear film to cornea, cornea to ciliary iris, and maybe reach to the lens, and it may get accumulated over there. So it may be created some toxic response. Sometimes you have seen that pigmentation seen into the lens also. It may be create a cataract also. So it's also like kind of barrier which restrict the toxicant to travel further and create some toxic response over the local site. Then lastly is the retina. Retina of the human and monkey, pigs, dogs, rats, mice have the dual circulatory supply. So that's what it's like. It is highly circular. I would say highly blood supplied part of the eye, but it has also divided into two part, like outer retina, which means the supply, which is the, we would say, late supply or vascular part of that retinal pigment epithelium, rod, cones, photoreceptor. These are the less supplied part of the retina, whereas the inner retina, that is outer plexiform layer, inner nuclear layer, and inner plexiform layer and ganglion cells, which are the have the higher supply of the blood. That's what they get affected through the topical route of the toxicant, as well as from the systemically or parental route administered compound may get affected this part of the eye also. So and ultimately affect the pharmacodynamic or pharmacokinetic of the eye. Here, some, as I said, the like some systemic drug or systematic drug or parental drug also may affect the pharmacokinetic of the or even exposure of the that compound. Oral or inhalation route or dermal route or parental route compound also get exposed to the retina and may create the desirable or undesirable effect depend on the compound's nature. And so this is the route where the any systemic route compounds come into the contact with the blood, and then travel to retinal choroid layer, then inner retina, and maybe travel to the nerve, brain, and the other organs also. Iris and ciliary body have some supply, whereas the cornea doesn't have the vascular supply. It's been nourished by the aqueous humor only, as I mentioned earlier. Then corneal epithelium and vitreous humor, so lens. So if any compound which been traveled through the systemic route, it may be reached to the retina and create the desirable or undesirable effect. So whatever, as we said, like any compound get exposed, but it should be reached to the target site. Then only it create the toxic as well as the non-toxic response. Here we can say to get the to deliver that compound, we have to explore the different route of the delivery. So here we can say the different route are being mentioned, like intracameral route, subconjunctival route, intravitreous route. By showing the location, you can understand intracameral route is the between the aqueous humor, means behind the cornea and before the lens. So that is called intracameral route. And topical, you know very well. Then subconjunctival into the conjunctiva, while is the intravitreal, it should be drug should be entered into the vitreous part of the body, vitreous body of the eye. Then systemic route will be travel to the blood to the retina and maybe travel up to the cornea. So this is also part of the retroverbal part is there. So normally whatever drug is there being created for the intended ocular route or otherwise for the topical route, the most important target point of the ocular delivery or targeting create the significant most important is the anterior segment and posterior retina, main target organ. If it is being created for the systemic route, then it will be a retina. and if it is like given for the topical route, it will immediately come into the contact into the anterior segment or anterior chamber. Then that's what there are like nowadays many small scales or nanoscale delivery system being created to approach site of action. That's to increase the delivery. If it is get increase the delivery, then it will get the more exposure and you can get the desirable effect. That's what the many like companies being creating the chitosan coated or like compact DNA drug coated lipid based or liposomal based or magnetic based been drug molecule been created to deliver maximum to get exposure of the maximum molecule to the site of action. One more is there, metallic particle remote magnetic targeting drug delivery. It's been under process. It's not been released now, but it is also under process to increase the exposure of the compound. Then metabolism. So metabolism and excretion of the xenobiotic occurs in all compound of the eye, and well-known phase 1, phase 2 enzymes are there, which you may have studied in other chapters also. But here there are the many CYP enzymes available like aldase, oxidase, ketone reductase, cyclooxygenase monomer. These are the phase 1 enzyme, as well as the phase 2 enzymes are available in the many part of the ocular systems, and it been take part in the metabolism of the alteration into that or even mutation into that CYP enzyme and we create the some toxic response. Here I mentioned the some of the examples like mutation or alteration in the CYP expression of CYP P1B1 may create the congenital glaucoma or corneal opacity. Even CYP A1, CYP A2, A2 are found in all bovine in mouse and been induced by the 3-methyl cholesterol and B naphthaliflavin. It's been induced only. This is the CYP enzymes. Then CYP4A1 present in mouse and CYP4B1 in corneal epithelium. That will be induced by the phenobarbital and peroxima porphyrin. That's what some effect of this compound, I would say, like topical anesthesia have been extended because this CYP enzyme present in the corneal epithelium of the rabbit. Then the corneal epithelium CYP monoxidum metabolize arachidonic acid into these two metabolites like STET hydroxy 5814 ecoesteric acid and 5-ST hydroxy 580 ecoesteric acid. This been converted into the two metabolites will be reacted and induce the changes into the corneal epithelium. Then phase 2 metabolism enzyme also present in the eye that includes the ubiquitin transferase which take part in the metabolism of the different compound. Although metabolism will take place with the phase 1, phase 2 compound, but most important role is also there is the transporter. If any compound or toxicant should be reached to the site of action, otherwise it will not give the desirable effect. So that's what transporter has one role. It may take part to expel the compound, or it may be get lead to the compound to the site of action. So in ocular system, there are the studies suggest that the ATP binding cassettes families transporters are available, and the solitary carriage transporter are also available, and organic anion catering transporter. This way, these compounds play a role into the normal balance of the homeostatic function as well as the chemical and toxicant exposure. Like as I said, it may be get expelled or it may be get lead to the site of action and further part into the disease and pathophysiology of response. Then lastly, we can see as a part of the pharmacokinetic central visual system pharmacokinetic. So in central nervous system, you might have heard that there are many barriers are available. That is called the blood-brain barrier, which control the transport of the any compound to site of action and maybe help to reduce the toxic effect of the compound because it's not allowing to reach to that target, or even I would say not target, the tissue which may create the toxic response. So in this central visual system also some of the barriers are available, like that is also called the blood-brain barrier, but it's not been properly developed, but some extent it been supporting to control the or even control, I would say, prevent the travel of the any toxicant to the so that compound which are the large high charge or otherwise not in very lipid soluble tend to be excluded from the brain, whereas the small uncharged or lipid soluble compound are readily get penetrated to the brain. So similar because whatever like visual system is there being connected with the central nervous system. That's what the similar mechanism is take place over here to control the toxicant to travel further. Now light. See, the most important oxidizing agent is visible light. Whatever lights come, whatever we are coming to the contact with the light, it is the oxidizing, which create the oxidation reactions, and that depend on the whatever UV range is there. Most visible range is that 320 to 400 nanometer, while ultraviolet radiation is the 290 to 320 nanometer, and high energy, it means not most damaging range is there, but normally we are not getting exposure to that. It may be exposed to the high altitude. So here, how they like, if they come into the contact, if you come into the contact the UV radiation, it will create the like photo reaction and photo oxidation and create the oxidative damage to that particular part. And how like they would create the this damage to it will create the oxygen reactive species, create the ROS like reactive oxygen species, and lead to the damage to the that part. This is the simple mechanism carried by the lights. But this mechanism of the lights also being used for the phototherapy also. If you consider as a phototoxicity, then definitely it will create the toxic response to the eye. But to care or even to treat the some of the part of the unwanted growth of the tumor, or even some I would say macular degeneration, additional angiogenesis there, that has been treated with the help of this ultraviolet rays. But that rays has to be travel to the control mechanism and to reach to the target organ, create the same following the same mechanism of the ROS, and damage that cancerous cells or tumor cell, or otherwise unnecessary created the angiogenesis. But this process been used for the treatment of the many of the disease. I'll show you in next slides. So absorption here is the cornea, which mostly take the 45% of the light wavelength below the 250, but only 12% of the between 330 to 400. The less much wave light they trigger, because cornea can absorb the maximum light of the 300, but if it is an ultraviolet, so difficult for the cornea. So in that case, the iris and will be helped to control the travel of the unnecessary lights. So that's what the meiosis and mechanism, meiosis and metastasis mechanism is there to protect your eye from the damage from the exposure of the light. Here I said that the phototoxicity being used for the therapy. So the phototoxic property of the chemical are being exploited for the photodynamic therapy, where the photoreactive chemicals are delivered to the pathological tissue such as cancerous tissue or inappropriate angiogenesis, as in age-related macular degeneration. Wavelength-specific light is introduced in the tissue, causing the photoreactive chemical to activate the therapy, initiating the free radicals cascade, kills the pathogens. So this tool being used in the control environment, but it is also creating the some side effects. But now some are being used. Here is the one of the example. This example is like it is not intended for the phototherapy, but the antibiotic or even this compound been delivered for the other purpose and been create the due to their phototoxic quality or even property, create the some ocular phototoxicity. Here is the example: fluoride carbon, or we can say carbon, the antibiotic ciprofloxacin and titanium dioxide being create the toxicity, phototoxicity due to their phototoxic property. Now, as I said, like these are the like morphology. We discussed like morphology and what are the barrier which will ultimately control the exposure of the compound, and what are the mechanism. Metabolism. How metabolism will take place with the delivering the certain compound to the ocular system, and may or may not be create the desirable or undesirable. But whether that compound, whatever toxicant come into the contact with the eye, it may be create the desirable or undesirable. How will you come to know? How you will evaluate that compound created the desirable or undesirable effect, and how will you identify or even report that? So if it been intended for the like ocular route, then definitely regulatory suggests you to perform the ocular studies, different set of studies to you have to perform. But some compounds get exposed to the accidentally to the eye. It may be due to the sometimes it may become into the occupational, or sometimes due to the environmental hazards created by the environmental hazard. So some drug which may not intended for the ocular route, but accidentally it may be come into the contact with the eye and may create the toxicity. So to identify or to control if any such events occurs, so how to control, to identify and to report to that, there are the two testing systems available for the specifically for the drug discovery perspective, if you can say, or even safety concern, you can say. One is the evaluation of a corneal irritancy, and second is the toxicity, that is full studies. Corneal irritancy means it's a local observations or local test being conducted to evaluate the accidental exposure or environmental or occupational exposure, which is created by the unintended chemical, drugs, or whatever. Like, and toxicity, full toxicity is being carried out for the compound which means intended for the ocular routes. So for the evaluation of the corneal irritancy, DABT test is available, standard procedure employed for the evaluating the ocular irritation and safety evaluation. Procedure is very simple. You have to instill the 0.1 ml of the liquid or even 100 milligram of the solid into the conjunctival set one eye, and then centrally hold for the 1 second, and the untreated eye serve as a control. Both eye evaluated for the 124, 45, and 72 who are performing regularly these ocular studies. They are knowing this procedure, but I'm just briefing over here simply. So to understand the what difference is there, ocular irritancy study as well as the full ocular toxicity study. So by after observation, we have to collect the scoring for the iris, conjunctiva, and cornea, and then score that, and accordingly you can classify that compound into the irritant or as well as a corrosive. There are the scale is available for the APA, define the category of the APA as well as a GSL, generally is considered as a hazardous. So these are the scales available for the ocular irritancy studies. While if you are going to perform these studies, normally being performed on the rabbit, that's albino rat, in normal irritancy study. But nowadays, like the interagency coordinating committee on the validation and alternative method, that is called the ICCM, recommended. Okay. So we were discussing about the DABT testing. Like the DABT test has the been as I said, like normally being conducted earlier for the, even nowadays also many people are conducting in the rabbits. But the DABT test has been criticized due to its high inter-laboratory variability and subjective nature of the scoring, and poor predictivity of the human irritants. That's what the most, and it also create the significant pain and distress to the animal. That's what the, as I said, like the interagency coordinating committee on the validation of alternative methods suggested that these are the tests being suggested and been approved to perform as a ocular irritation studies. You can see over here evaluated for the limited usefulness, hemorrhage, coagulation, test method for the indicators, objective of the test, ocular and sensitive. So according, these tests are acceptable for the from the regulatory body. Instead of the performing the rabbit irritation studies, you can perform this in vitro ocular test, and you can submit variable for the your irritation studies. So that is the part of the like ocular irritation studies. And as I said, so if any compound being created for the ocular studies typically, and you have to, as per regulatory recommendation, you have to perform the whole ocular studies, or for the any compound, you have to evaluate the ocular effect or even toxical effect to the ocular system. You have to perform the whole ophthalmological studies, including the pupillary light reflex, which when we started with the naked eye observation, you have to perform the naked eye observation, where you can see the eye attenuation, including the eye lacrimal gland, apparatus, palpable conjunctiva, non-palpable conjunctiva, that you can see with the naked eye, and you can score accordingly, and you will mention. Then you can use the ophthalmoscope also, where the direct and indirect ophthalmoscope is available. You can study the retina, that is called the fundoscopy, where you can see the any changes being occurred into the retina, that you can understand and describe while you are performing these ocular studies. And slit lamp and slit lamp microscopy is there. That is also like study the cornea, lens, and anterior chamber. This slit lamp also being used for the test also, but that is part limited for the cornea. While here you can see up to the lens and anterior chamber also. That is whole studies part. If any ocular study is there, then pupillary light reflection also there. You have to if any like changes you are observing pupillary light reflection, that also been helpful to define the changes being taken place by the ocular installation. The examination of direct pupillary reflection involves the shining the any lights, bright light to the eye and observing the reflection of the pupilla. Observe the reflex, and while you are shining the light to the eye, and the parallel eye should not be get affected, and it will, if it is giving reflex, so you can understand the water, like where you are striking the light, it giving the reflection. But other than the eye which is not been reflected with the light, it also give the light reflection. Then you can understand whether your like connected central nervous system which giving the reflection of this reaction, it being affected or not, that you can understand with the this pupillary light reflection. Then intraocular pressure, if any your anterior chamber where the ciliary body and ciliary muscles or like which produce the aqueous humor, the drainage is there which been flow this aqueous humor to out from the ocular or this anterior chamber. It been blocked due to the accumulation of any compound or created by any inflammation or something reaction is there, and the accumulation of aqueous humor will occur and it will increase the pressure to into the anterior chamber. So that can be studied with the IOP, that is tonometry being used for this, and you can measure and you can mention. And other than that, if any ocular compound is there, you have to study the some like electrophysiological technique you can use to study the further detail into the retina as well as the other part of the body, ocular system. The most electrophysiology or neurophysical procedure or testing visual function in the toxicology context involve the stimulation of the eye with the visual stimuli and the electrical recording potential generated by the visual response. It is like ECG. ECG being conducted for the cardiovascular system, while in for the this I would say ocular system, or it's been EEG and some others are also there available. So this physiological technique being used for to understand the any toxic response to the retina or other part of the ocular system. So electroretinography is there, visual evok potential is there, and very less being often used the electrooculogram. Here is the some detail for the electroretinography. The typical ERG waveform include the an A wave that reflect the activation of the photoreceptor and B wave that reflect the activity of the retinal fluid. While being light being reflected to the rabbit, means here is the like study rabbit is there. That's what I'm saying. If you are going to perform the ERG in the like non-clinical setup, then you have to use the rabbit. Otherwise, you can use the dog also. While in human also, it being regularly ERG being conducted to with the toxic response to eye. So if any light being reflected, the B waves being created reflect the activity of the retinal bipolar cells, whereas the associate member potential changes in the. So here is the protocol where been studied in the light, presence of light as well as in the absence of light, how the roads and cones been reflected, that graph being created with the electrical changes over here and being measured and recorded and interpreted accordingly for the identify the any toxic response or present or not there. Then visual evok potential and electrooculogram. This is also like one of the procedure being used very rare, means mostly not being used, but some of the laboratory animal use for the to perform such kind of change, electrophysiological techniques to understand the activity of the reticular nucleoside street pathway and activity of cells and visual cortex. Same way, EEG can help detect the condition like retinitis pigmentosa, where there is a loss of electric activity in the retina. The USFPA published the guideline for the EVP testing toxicology context along with the analogous sensory evok potential procedure for the evaluating the auditory and somatosensory function. This being conducted for like depends what compound you are studying or what route of application is there. Accordingly, you can choose. Well, I'll show you later in another slide what like parameter you can include your study. Behavior and physiological techniques have been used for the evaluate the activity of the compound, toxic response of that compound. Typically vary with the parameter of the visual and stimulus, then determine whether the subject discriminate the perceived stimulus and manifest the visual function, and human laboratory animals being used for the identify the absolute luminance threshold, like it can identify the lights, then visual activity, how visual activity being reacted, color difference, and spatial means place can be identified or not. Though some like flicker, sometimes like flipping light will be reflected to that animal and being response being recorded to identify how it's being behaving and what psychological changes being taken place, where it be created by the any toxic response or not. So that when will be used for the evaluate the physiological responses. Then color visions are the red grain color deficiency mostly occur in the 88% of the male, it's sex links, whereas the about 0.5% of the female. This term is the protonia, red green color confusion caused by the abnormality in the absence of the long wave red, that is sensitive cons, L type. Same leukopenia caused by the abnormality or absence of the middle wavelength sensitive. That is, so it being some human being have a difficulty to identify differentiation between the these colors and these terms being used to call or record the disease condition and being tested into the animal whether this compound or toxicant creates these changes or not. Rarely being trinotopenia being used, congenital loss of the short wavelength that cons resulting in the blue-yellow confusion. This is the like method being used to identify these changes. It being used in the human only mostly. Animal, some different technique being used to identify. It's difficult now, but I just show the picture to understand that. So there are the two tests: the freshwater, the Monson 100U, and freshwater, the D15. This second one is largely used in human to identify the vision testing. You might have seen in ophthalmologist room. Sometimes you have to go for the ocular examination, and you can see that they will show you the color changes, whether you have Dalton effect or not, to identify that. Then visual toxicity screening, FOB being used to understand the like functional observation battery, the automated measurement of motor activity and neuropathy. Though like it has limitation to identify the like automated or even observation functional battery being used, mostly used to observe the neurological changes. But still FOB have advantage and it will successfully determine visual effect also. That is the one example, 3,3 imidodipropionitrile carbon dioxide, which create the defect in visual activity being observed by the FOB, functional observation battery. Normally being used for the neurological studies, but this is also being used for the sometimes for the visual activity screening. Now, like we have seen the morphology of the eye, what are the part of the eye, how it get exposed, and how the drug being delivered to the with the different routes, and if it they reach to what changes being taken place, how it is get metabolized, and what transporters are there which will help participate into that. Ultimately, it may be reached to the target site, and by, with the some mechanism, it create the I would say desire or undesire. Here we are discussing about the toxic response. So I would say toxic response in the target sites. So here first we'll see the cornea where the toxic response being created. Some of the chemicals here cornea is transparent outer layer, first layer which we said. Some of the chemical create the toxicity like solvent, acid, alkali. The product which carry the highly acidic in nature like 2.5 or even highly alkaline nature may create the vision loss or sometimes damage the ocular tissues. And some medication or even drugs also create the toxic response to the eye, like chloroquine, hydroxychloroquine create, will get deposited into the eye and it will attach to the melanin, which means available into the anterior chamber of the eye where the ciliary body is there, which will carry the melanin. This chloroquine get attached to that melanin and will be accumulate over there. As I said, if any chemical or any compound or any drug is get accumulate over there and over the period may create the difficulty. So it will by depositing create the toxic response to the eye. Then some infection like bacterial, viral, fungal or infection also create the keratitis or some inflammatory changes into the cornea. UV radiation, ultraviolet less than the 270 nanometer leading to the photokeratitis and temporary vision impairment. Some people are using the, you might have seen the welders using some highlights and it may create a welder dark burn sometimes. It is temporary only, but it's create also. Then to lens, there are risk factor development the cataract. In lens, mostly cataract, you heard the changes, toxic response of the any compound or even local reaction is a disease which been normally created to the lens is cataract. It been created by the aging or diabetic or low antioxidant level. And these are the three chemicals or compounds being used means create the changes in the lens. First one is naphthalene, metabolic naphthalene, and metabolite of the naphthalene is the naphthalene dihydrogen when aldolate detectors induce the cortical cataracts in lens, while the prolonged use of the corticosteroids drugs like it may create the epithelial gap or sometimes create the crystalline adducts, and that's what is create the cataract into that. And some of the drugs like phenothiazines also create the deposit in the lens and create the cataracts. Same way in the if you go to the retina, there are the many factors which affect the change, create the alteration in the structure or functional changes into the retina. Compound with highly because this retina is highly penetrated with the choriocapillary high supply, as I said, the very high rare oxidative mitochondrial metabolism, high daily turnover of the rod and cones, high susceptibility of the rods and cone degeneration, presence of susceptible ribbons, synapses, and presence of numerous neurotransmitter and neuromodulatory systems, presence of number. These are the list, like it's that's what we can say. It's a vulnerable, highly vulnerable. Ultimate thought is like being highly supplied, have high metabolic rate. That's what it easily get affected by the many of the reasons. That's what we can say. It's a vulnerable to any toxic induced changes. And then retinotoxicity, as you said, there are this earlier was the factor, while the retinotoxicity being created by the two ways. One is the systemically administered compound, which being created toxic response to the retina, while other toxic neurotoxicants, some of the drugs being used for the neurological disorder or sometimes given for the other reasons, especially for the neurotoxicants, which are indirectly create the degenerative or alteration into the retina. So here we have mentioned some of the like cancer therapy compounds, cytological agents like alkylating agent, cisplatin, carbon causes the degeneration into retina. The antimetabolites like cystone, arbinoids, and 5-fluorosis also create the degeneration into retinal, create the retinal degeneration. The mitotic inhibitor docetaxel also create retinal degeneration. Inhibitor of the GABA transmitter vigabalin and retinopathy create cardiac glycosides like digitoxin, digitoxin, inhibition of the con and photoreceptor and create the ultimately the retinal degeneration. Antimalarial drug which we have discussed earlier, chloroquine, hydrocortisone, degeneration of retinal epithelium underlying the photoreceptor. The condition bullae retina has been mentioned mostly seen in the like human, but it's been created by the chloroquine, where the deposits occur into that retina part and it's give the like bullae appearance surrounding to the retinal part. Some of the NSAID also create the retinopathy, that is endomethacin, tamoxifen. Then data dysfunction drugs like sildenafil, tadalafil, and these are the create the retinopathy. Non-electric anterior ischemic ophthalmic neuropathy being created by the sildenafil drug mostly. Here is the tabular showing the same mechanism and effect being created by these drugs. Just it's already discussed. Then the target sites for the optic nerve and tract. Here are the agents: carbon disulfide, ethamyl ethylene glycol. These are the agents which create the optic neuritis. Effectively reduce the contact sensitivity in the visual activity. Amyloidoglycan, cinnabar, we have already said. Also create the mononuclear and binocular vision loss. And even central nervous system, you can say the methyl mercury degeneration of the calcium and fissure of the visual cortex, which create the central stroma. Lead also create the visual and motor cortex dysfunction. So here we have seen the most of the like compound which create the toxic response to the eye and structure and all, and lastly with what are the mechanism in take place to create the toxic response to eye, including the retina, cornea, whatever most important part of the eye. Now we are moving forward to guidelines. Like these are the guidelines mostly imposed for while you are performing the ocular toxicology studies. The ICMS M3 are the USFDA, USFDA, USFDA full form, any compound being intended for the dermal route and being translated into ocular route. So this guideline will be applicable. So ocular toxicity testing involves the combination of preclinical animal studies and clinical trials assessment and post-marketing. So like this guidelines suggest what study designs to be there, what animal to be used, and how alternates are available. and what actual finding you have to report to study the any toxic response of the any compound, whether it's occupational, like accidental, or it been intended. So here is the important difference I have mentioned, like OITS means ocular installation toxicity study, and whereas the eye irritation testing. Here sometimes I have observed like many people get confused, like what is the difference between the eye irritation studies and ocular installation testing study. Eye irritation, I mentioned earlier, also being conducted for the compound for the which is not been intended for the ocular route, but accidentally or occupationally get exposure to the ocular system and will create the toxic response. To understand that, this eye irritation studies being conducted, and nowadays alternates are also available other than albino rates. The guideline is for that OECD 404 405, and that is a single day single day installation is there, while the observation is for the 21 days, and mainly anterior part being observed like cornea. Sometimes required, then you can go for the anterior chamber also, and gross observation only limited. If required, you can further for the histopathology. While if you are going to perform the ocular installation studies, then you have to go with this guideline ICH S4 and M3. Rabbit, monkey, dog can be used for the these studies. Rabbit, monkey, and dog most preferable. Monkey is most preferred because eye globe is although half for the human, but more like morphology of the that monkey eye is similar to the human, especially macula being present in the monkey. While rabbit, dog, and there they have additional like Hadarian gland and nictitating, and that is the additional part which normally present not present in the human. And the dosing duration depend on the duration of the clinical trial support the eye ocular examination, the whole eye, whatever, like I said, that if you are going to perform the like irritation study, you can limit it with the only for the anterior chamber or cornea. While you are going to perform the ocular examination for the full ophthalmological study, you have to go for the like physiological techniques and even ophthalmoscopy, slit lamp biomicroscopy, whatever tools are available, you can have to carry out that. Systemic examination, including the crucial pathological histological examination. And in this ocular studies, you have to define the two NOEL. One is for the local, and one is for the systemic. Whatever available, it's not necessary. Sometimes not you cannot get the both the NOEL, but if it's possible, you can define with the both the NOELs like local as well as the systemic NOEL. What are the inline parameter you have to included in your study if you are going to perform the ocular installation study? These are the like fundoscopy, tonometry. Some are already discussed. Depends on the study which your studies you are going to perform. As I said, like depends on the your compound or nature and study or study duration. You can select the whether it's a GLP or non-GLP study. You can select the parameter. So this is the table carry the sum of the compounding. Some of the parameter you can include in your inline parameter studies of the ocular compound. And this is the pathological parameter you have to include while you are going to perform the ocular studies. Like you have to observe normally in the non-ocular studies, you are going to observe the general morphology of the eye, while you are going to perform the typical ocular studies like intracameral, intravitreal, or topical eye drops. You have to conduct the pathology of these organs also. So this is for the additional information I kept over here for the who are going to like perform or you are going to get exposed for the ocular studies. And this is like for the information relative systemic dose level for the human, cynomia monkey, dog, what body weight mean consider while you are going to perform the any ocular study for the human or compared to dog, rabbit, and mice. So administration to the eye, both eye in normally in monkey being carried in one eye, while installation frequency 1, 2x or 2x depends. Like you can define according to whatever there. So this is additional information I kept to for the apart from the our. So overall, the toxic response to the eye is not limited to the only cornea and retina. There are many other organs also there which take part of the into the toxic response of the eye. But major gatekeeper I said is a cornea as well as the retina, which means the retina is connected highly vascular and is connected with the central nervous system. That's what is important. While cornea is the entry part of this ocular system, that's what we have to take care of that. So thank you from my side.